Hi guys, it's Val again. So today we're going to be looking at a wound, a pressure sore wound, stage 5. So this is something you really don't want, and this is a good reason why you have to move your patients every 2 hours if they're not very mobile. So here we're going to be looking at the sinus. So you see there's a depth here. So this is a sinus going up. And if I turn it around for you to see better, here you have a tunnel. So everything will have to be cleaned as prescribed. That's very important for you to know. So I'll put it sideways so you can see a little bit of both sides. So once I have my prescription, it will gauge me. I will go look at what the person before me did. So that will gauge me on all the material, just in case that when they did the prescription and now there's changes or they need more material. So I will just validate that information before going. I will also go see my patient before starting to make sure she's not in a lot of pain. Because if she is, I'll give her, if she has a PRN, pain medication, maybe a half hour before starting. So just to make it more comfortable for my patient. First thing I want to do, after gathering, if we look here aside, I have all my sterile field ready. My NaCl is in it. I have my tools that I will need. And everything that is not open that I will be explaining. So this syringe, I will open it later when I put my sterile gloves on. I will need it to be able to irrigate inside the pressure wound. I don't even need to have my gloves on because I'm not touching anything, right? But one thing I do need to look at is my expiration date. Don't forget that part, expiration date. So here, I can even hold it by under. I can just hold it and drop it in. My hands are not sterile. Always have your garbage with you when you do a wound or any type of job you have to go do for a patient. Have your garbage with you so you're not throwing anything everywhere. I will have an abdominal pad that I will use afterwards to cover my wound. So I'm not going to open it right now. This, c'est de l'Ipafix. And this is really nice. It's a tape that you see. And it's cuttable at different lengths. So to cover with my abdominal pad, I don't need a small tape. I'll have this. And this is just to cover, so it does not need to be sterile. NaCl, so I decided to use a syringe, but I could also use these bottles of NaCl. Look at your prescription. It will guide you a lot more. So this, expiration date. Here, I have my packing, because I will need to put some packing in my wound, right? So there's 2 different products that I have. It's the same thing, just a different packaging. This one has a specific length and a width. This one is very long, so it's for multiple uses. And you have to be sterile when you need to have somebody with you to prepare this. It'll be easier. And you have different widths. So make sure that you look at your width before. I will be using this one. It has a specific length. It's better. I have some gauze. I will need gauze to make my fluffing. You'll see what fluffing is. It's because I don't want to compact. I don't want to compact my wound, right? I don't want to make it really tight. So I want to be able to just fluff it and just put it in so it stays moist, because I don't want to dry out my skin. If I dry out my skin, well then my skin's gonna die, right? And I don't want that. So here, I'll open both of them. There you go. That's done. I will open my packing, and I'll just leave it in here. Expiration date is good. So here, I can just take it by this side and push it in. My material's all there, okay? I'm not going to open, I won't have any more space. I took two. One will be to measure, and know that on every sterile Q-tips, on the other side, you have a ruler. So if you say, oh, I didn't bring my ruler, it's okay. You have one on each packaging. A lot of the packages that you have will have, these ones don't have it, a lot of the packages that you have do have a ruler for you to be able to work with. So the first thing I'm going to do is I have to measure my wound. I have to measure the depth of the sinus and of the tunnel, because I want to know if it's better, getting better, or if it's worsening. So to be able to advise the doctor and the nurse, you need all the information. If there's more redness, if you see pus, everything, you have to be able, if there's any smell, if your patient is in more pain. So I'm putting non-sterile gloves on to measure. So how do you measure? You will take one cotton. I like using this side because it's softer if it goes at the end of the tunnel. Instead of this side, it can hurt a little bit more if you just go too deep. So I will just put it in, and I will go to the end. I move it around to make sure I am at the deepest. I will put my fingers, here, I'll let it go. I will put my fingers to where I see the outside. So here, I'm in. I'll leave my fingers here, and it will tell me that I am 4.5 centimeters deep. I have one measurement. Now, have another one, and this one is 2.5 centimeters deep. You always have a reference, so you'll know if you're really off or close. So here, if I go at the deepest, I will go down here, and it is 2.5 also. Now, I just want, I'll take another one because this one is like a little bit dirty, so I throw it out. I can use the outside just to make sure that it's easier to count. Here, I'm at 7.5 centimeters, the width, and the height, which is the length of the person. So this is the exterior part that I'm measuring. .5. So I have 10.5 by 7.5. That's my exterior. Then I will say my tunnel, the depth it had, and I will say my sinus, the depth it had. That is very important, and it's important to say the wound, the complete wound exterior measurement, the width, and then on the bottom left quadrant you have the tunnel, that is how deep it is, but you have to write it down. Tunnel, this depth. Sinus, this depth. You make sure you have all your measurements and what you see. So this is granulation tissue. I can see the bone. I can see necrotic tissue. So you have to be specific on where you see it. It's very important to be able to chart it well. Okay, so now that my measurements are all done, I will remove my gloves. I will clean my hands. Take this out of the way. I have my gloves with me. And remember that when you have a sterile field, everything below the waist, not sterile. So if you want to have your garbage closer in between, to make sure that you put your things in your garbage. And see, I'm out of space here. So the important thing, I'll ask my patient, is it okay if I use the side of your bed? He's not moving? No? Okay. Expiration date, it's good. Oops, they fell on the ground, but I'm not going to go get them. I just clean my hands. So once you open your gloves, we've seen this technique, how to open your sterile gloves. Space here is quite a thing. Thumb in, make sure it's easier. I just lost a finger. I'll get my finger back. Trying not to touch anything. The center here is still sterile, so I can just put it in my garbage. Now I'm ready to start. Hands up. So now what I want to do is to be able to go irrigate. So the first thing I will do is use my syringe. Fill it. Oh, peanut. Fill it up. There you go. And I try not to wet my sterile field. So this I don't need for now. I've got more here, so I can use these. I will start inside, but just the surrounding wound, and it will go in, because the wound is cleaner than the, the exterior. So I will just, depending on your prescription, you will see what you have to do. See, it's all falling down. There you go. So this is done. I cleaned it. Now I will just apply. I don't want to touch it. So I'm just going to apply them so it dries. I want to make sure everything is dry, because if there's too much dampness or humidity, it'll just be good for fungus. And I don't want that. And just so you know, these tweezers, it's not the best thing in the world, but you have to try to work with it. Now I'm trying to just to get the exterior surrounding. You can do them one by one, or You can dip them all in and just take them out. Take both sides of the tweezers. There's different ways. You're gonna see how you feel more comfortable doing it. I'm kind of stuck. It's staying right there. This will be my last one that I need. That was not very nice, Valerie. There you go. So now that I've dried it all, what I want to do, this usually has to be moist, because if it's not moist, it's going to just rip the good granulation tissue. I don't want that. And with the measurement that I had, I don't need a lot. You would choose the appropriate the appropriate width, because if you have like a 3-inch width and you only have a little sinus that's about the width of a Q-tips, you're not going to put a big one in. Okay, so now, I don't know if you can see well, one thing that's important is always, so I'm going to unroll, and I don't want to be pulling back and forth. And right now, this is placed for you to see well, not me. It's try to do a zigzag. And what's important is to keep the last part out of there. So here, that's good. This is what I mean by fluffing. Be careful not to fluff too much, because these little particles can stay out. So you just leave them in, but just make sure that, you know, it's not stacked like a closed one. So you want to be able to just push it in without applying too much pressure, but you want it to cover the whole place inside. I'm lucky, I've got enough. So here was my packing. So I want my packing to fill all the inside. Now that it's all covered, it's okay for me to open something that is not sterile, because it is all covered. Here, first thing I check, expiration date. And my prescription told me to cover with an abdominal pad. So I can either, like this, if it can cover the whole place, or this way. I rather this way. Why? It will not cover any part of the bum, because on the top of the crack, it itches if it gets too damp. And this is lovely. It does not stick on gloves, so it's easier to open. There we go. Didn't I have a second one out? And it's very easy to remove. So, how are you doing, Mrs. Walsh? Good? There we go. So now that I'm sure that it's very well covered and all secured each space, my patient's comfortable, this wound is taken care of. Now I have to go chart. What did it look like? What I removed? What did my dressing look like? What was on there? Was there anything? Or when I took my 4x4s, was there a lot of blood, purulent, any odor? I will chart everything from what I removed. I will chart everything what it looked like, my measurement, and what I applied to cover. Thank you very much. Now it's time to clean up.